could, using a common fitness device, maybe in a way that goes against the instructions, lead to a really surprising medical issue, maybe even years after a surgery?
That question is, well, it's absolutely central to a fascinating and pretty rare case study we're going to unpack today. It really highlights how, seemingly simple actions can have complex consequences.
Especially when you mix in unique personal circumstances,
That's
right?
right.
Welcome to the deep dive.
Yeah.
We're here to take a stack of sources, sort of strip away the noise, and just pull out the most important insights for you.
And today, we're diving into a very specific medical investigation, but it definitely has some broader implications, I think.
So what's the focus?
We're looking at the intersection of using electrical muscle stimulation, EMS devices, those gadgets that send little pulses to make your muscles contract.
Right, yeah.
That and a potential complication related to breast implants.
Okay. And our main source for this deep dive.
It's a peer-reviewed research paper. So this isn't just someone's story. It's a proper case study published in a medical journal.
And it was actually highlighted by one of those research digests that simplifies science.
That's right. Makes it a bit more accessible. And the study itself, it comes from a really highly respected institution in Tokyo, Japan, the Cancer Institute Hospital of the Japanese Foundation for Cancer Research. They're known for work in reconstructive surgery and oncology.
Okay, solid source then. So our mission today.
Yeah, our mission is basically to walk through this unique case step by step. We want to understand exactly what happened to this patient.
Dig into how the doctors figured it all out.
Right, figure out what was going on, explain why this specific chain of events likely caused the problem.
And most importantly, pull out the key lessons that, you can take away, even if implants or EMS devices aren't part of your life.
Absolutely. There are wider takeaways here.
Okay, let's set the scene. This case study, it centers on a 48-year-old woman.
Right. And the background is important. She had undergone bilateral breast augmentation surgery, so implants in both breasts, about 2 decades before this incident.
20 years. Wow, that's a long time.
A very long time. So those implants are well settled, part of her body's landscape, so to speak. She also had another procedure, a bilateral mastopexy, maybe 10 years before this
A
incident.
mastopexy. That's a breast lift, right?
Yeah, exactly. Sometimes done to reshape or lift, maybe after augmentation or later on.
So 2 procedures, implants in place for a good 20 years. Okay. And then this incident happens. When was this?
This was July 2018. She noticed a sudden swelling, specifically in her right breast, about a week before she went to the clinic.
Sudden swelling. Okay. And did she know what might have caused it?
Well, when she spoke to the doctor, she reported something very specific. About a week before the swelling started, she'd use an EMS exercise device.
Okay, the EMS device. Where exactly did she use it?
On her right chest area. She said she was focusing specifically on the pectoral muscle there.
The pec muscle.
Yeah, she apparently felt that muscle was weaker on her right side compared to the left, so she was trying to, target it for strengthening.
Okay, so using this device right near the area with the implant, was there anything unusual about how she used it? Because, lots of people use EMS devices.
And this is really the critical point. The paper emphasizes this. She used the EMS device on that right chest area for a really extended period. We're talking roughly 2 hours in a single session.
2 hours on one spot.
Yeah.
Is that normal for these things?
Not at all. Massively out of the ordinary based on, typical recommendations. The research paper actually notes the manufacturer's instructions usually advise limiting use to maybe 30 minutes per day on the same area, max.
30 minutes a day. And she did 2 hours in one go.
4 times the recommended daily limit all at once, right over the muscle covering her implant. Apparently, the patient herself just didn't realize this was an excessive duration.
Wow. Okay. So significant overuse, way beyond guidelines, right over an implant. And then within a week, swelling appears. What exactly was that swelling?
The swelling turned out to be an accumulation of fluid around the implant. It's called a seroma.
A seroma, okay.
And because it developed so many years after the original surgery, it gets a specific classification, a late seroma.
Late seroma.
Seromas can happen soon after surgery. That's relatively common. But a late seroma popping up years later, that's less common and definitely makes doctors take a closer look.
And was it a lot of fluid? You said swelling.
Oh, yeah, quite significant. The medical team actually had to drain the fluid multiple times. On different visits, they aspirated, used a needle to draw out the fluid amounts like 500 milliliters, then another 250, and even up to 1,000 milliliters, a liter.
A liter of fluid
Yeah.
from around the implant. That's a huge amount, like a whole water bottle's worth.
Exactly, a substantial volume building up there.
That must have been really uncomfortable, and I imagine medically quite concerning.
Yeah.
When doctors see a late seroma, especially that large, what are they immediately worried about? What do they need to rule out?
Yeah, that volume and the timing definitely raise red flags. While sometimes they can be harmless, a late seroma, unfortunately, can signal more serious issues.
Like what?
Well, things like an infection around the implant. Or, critically, a specific type of cancer called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL.
BIA-ALCL. I've heard of that. That's the rare lymphoma linked to certain implants, right? Caused some recalls.
Precisely. It's rare, but it's a known serious complication, especially linked to some textured implants historically. So whenever a late seroma shows up like this, ruling out BIA-ALCL becomes, top priority.
Okay, so a major concern. How did the medical team in this case actually investigate? How did they rule those things out?
They followed a really rigorous process, standard protocol for evaluating late seromas, especially potential BIA-ALCL cases.
Yeah.
First up was an ultrasound of the breast.
Case standard imaging.
Right. That confirmed, yes, there's a large collection of fluid around the implant, but crucially, the ultrasound didn't show any signs of a mass or like a rupture of the implant shell itself, so the implant looked intact.
Good news there. Did they analyze the fluid they drained? That liter of fluid?
Absolutely essential step. They described the fluid as brown, serous, which means sort of watery, yellowish, like blood serum, and low viscosity, so quite thin. And yes, they sent samples off for extensive lab testing.
What kind of tests?
Well, standard cultures first to check for any bacterial or fungal infection, aerobic, anaerobic bacteria, fungi, even tests for less common bugs.
Right, check for infection first, and then?
Then they went deeper, specifically looking for any signs of malignancy, cancer, especially BIA-ALCL. They did cytology.
Cytology, looking at the cells under a microscope.
Exactly, to see if any individual cells look abnormal or cancerous.
And what did that show?
The cytology report mentioned finding foamy cells and lymphocytes. These are immune cells you often find in fluid collections, but importantly, no atypical or malignant cells were seen. So nothing looked like cancer under the microscope.
Okay, so no obvious cancer cells, and the cultures ruled out infection. How else did they double-check for BIA-ALCL? It sounds like they were being very careful.
Extremely careful. This is where the more advanced testing comes in, the stuff that specifically targets the markers for BIA-ALCL. They did histology, which looks at tissue structure, and also flow cytometry.
Flow cytometry, what's that?
It's a technique that analyzes cells one by one as they flow past a laser. It can identify cells based on specific protein markers on their surface, and they were looking for one marker in particular, CD30.
CD30, why other one?
Because CD30 is a protein marker that's commonly found, usually in high amounts, on the abnormal lymphoma cells in BIA-ALCL. Finding a lot of CD30 positive cells in the seroma fluid is a key diagnostic sign for it.
Right. And did they find any?
Critically, no. No CD30 positive cells were detected by flow cytometry.
Okay. Wow. Anything else?
Yes, one more layer. They also performed genetic testing, looking for something called T-cell receptor gene rearrangement. It's another sophisticated test that can indicate the presence of a T-cell lymphoma, like BIA-ALCL.
And the result?
Also negative. No T-cell receptor gene rearrangement detected.
So let me get this straight. They did ultrasound, extensive fluid cultures for infection, cytology looking for cancer cells, specific flow cytometry for the BIA-ALCL marker CD30, and genetic testing for lymphoma. And everything came back negative for those serious causes.
That's right, and a very comprehensive workup.
So after ruling all that out, what was the final conclusion? What did they decide caused this massive late seroma?
Well, based on excluding all those more serious possibilities and combining that with the patient's very specific history, the timeline, the EMS they diagnosed it as a traumatic late seroma.
Traumatic, caused by trauma.
Yes, but the trauma in this really unique case was attributed directly to the excessive electrical stimulation from that EMS device. Her report of using it for 2 hours right over the implant area, that was the smoking gun, really. It linked the external force to the internal reaction.
The traumatic seroma caused by an EMS device. That is specific. And the paper talks about how that might happen, right? What's the proposed mechanism?
Yeah, this is fascinating. They proposed a purely mechanical explanation. It wasn't an infection, it wasn't cancer, it was physics, basically.
Physics. How?
They actually draw a parallel to another rare case they found in the literature, where repetitive external trauma from, believe it or not, a breast pump caused a late seroma.
A breast pump. Wow. Okay.
So they hypothesize a similar physical mechanism here. The idea is that the excessive, really forceful and repetitive muscle contractions induced by the EMS device hitting that pectoralis major muscle for 2 hours straight.
Which sits right over the implant.
Exactly. That subjected the implant and the tissue capsule around it to significant mechanical stress.
The capsule, that's the layer of scar tissue the body naturally forms around any implant.
Precisely, a thin, fibrous layer. So the theory is these intense, prolonged, unnatural contractions from the EMS could have caused this capsule to basically rub against, or maybe even slightly shear or separate from, the surface of the implant itself, over and over again.
Like creating friction, or a kind of sliding rubbing motion between the capsule and the implant?
That's the idea, shear forces. And the paper even mentions that if the implant had a textured surface, which some do, the roughness could potentially exacerbate this kind of friction.
Okay, that makes sense.
So this repetitive, forceful, mechanical irritation between the muscle, which is contracting like crazy, the capsule, and the implant surface,
Yeah.
it leads to inflammation.
And inflammation causes fluid buildup.
Bingo. Inflammation often results in exudate, the accumulation of fluid, and that's what a seroma is. So the EMS didn't infect anything or cause cancer. It seems to have caused a physical, traumatic irritation just through sheer mechanical force transmitted via those intense muscle contractions.
It really paints a picture, doesn't it? The muscle essentially acting like a little hammer, repeatedly striking the area around the implant because of those electrical pulses for 2 solid hours.
It's a powerful image, yeah. And it's really worth emphasizing just how rare this specific scenario seems to be. Late seromas themselves aren't super common, maybe occurring in a small percentage of implant cases overall.
And traumatic ones are even rarer.
Much rarer. Only a handful of documented cases linked to external trauma. And this specific case, linking it to excessive EMS use, the paper highlights it as potentially the first report in the medical literature.
The first time this specific cause has been documented.
Which is why it's such an important case study, even if it's just one patient. It identifies a potential mechanism, a potential risk factor that just wasn't really on the radar before.
So after they figured all this out, ruled out the really scary stuff, drained the fluid, what happened to the patient? How did she recover?
Well, the good news is about 2 months after she was referred to that specialized hospital and they drained the fluid, the swelling in her right breast resolved completely, spontaneously.
Oh, great. So no further treatment needed.
Nope. Just the drainage and obviously stopping the problematic EMS use. The trauma was removed and the body healed itself.
That's a relief. And it really reinforces a link back to the cause they identified, doesn't it?
It really does. Which brings us straight back to those usage guidelines for devices like EMS.
Yeah, that 2-hour session seems critical here.
Absolutely. This case is like a stark, real-world example of why those manufacturer recommendations aren't just suggestions you can ignore. The paper specifically points out the guidelines. Max 30 minutes per day on one area.
But there's more to it than just time limits.
Exactly. Just as importantly, the instructions often advise avoiding using the device directly over areas where you have artificial medical devices. That includes breast implants, pacemakers, things like that.
Because, as this case clearly shows, those devices aren't just making the muscle twitch in isolation. That contraction exerts force on everything underneath and around it.
Precisely. It affects the implant, it affects that capsule.
Yeah.
So while EMS devices can be, perfectly fine tools for muscle conditioning or maybe recovery when used correctly.
Following the rules?
Following the rules, yeah. This case is just a powerful illustration of the potential for unintended mechanical trauma if they're used excessively or on areas they shouldn't be used on, especially when someone has that unique context of a medical implant.
It really highlights the importance of reading all the instructions, doesn't it? Not just how to turn it on, but the warnings, the duration limits, the areas to avoid.
Absolutely. It's about recognizing that even seemingly simple consumer tech can have pretty complex interactions with our own physiology, especially if our anatomy is altered or we have medical devices inside us.
So it's a reminder to be mindful.
Definitely. For anyone using an EMS device or really any kind of at-home health or fitness tech, just take that moment. Understand the guidelines, Know the contraindications, the situations where you shouldn't use it, and think about your own body's specifics. Implants, pacemakers, other conditions, it all matters for safety.
And don't assume that more is better or that following just, some of the instructions is good enough.
Exactly right.
Okay, so let's maybe wrap up this deep dive. Where have we landed?
Well, we've explored a highly specific, but I think incredibly insightful case study. A woman developed a late seroma, that fluid collection around her breast implant, years after her surgery.
And the trigger, identified after ruling out serious issues, was the prolonged, excessive use of an EMS device right over that implant area, way beyond the recommended limits.
We saw how the medical team did a really rigorous investigation. They methodically ruled out infection, and critically, they ruled out that implant-associated lymphoma, BIA-ALCL. It shows just how important that thorough diagnostic work is when you face unexpected complications like this.
Yeah, they really covered all the bases.
And we understood the proposed mechanical explanation, how those intense artificial muscle contractions going on for hours could literally cause traumatic irritation and fluid buildup around the implant and its capsule through physical force.
So connecting those dots, this admittedly rare case, it really illustrates a much broader principle, doesn't it?
I think so. It's about the necessity of respecting the technology we use, understanding its intended limits, its potential interactions with our own bodies, especially when medical implants or devices are part of the picture.
Adhering to usage guidelines, it's not just about getting the best results. It's fundamentally about safety, minimizing risk.
Yeah, being mindful of how external forces, even from seemingly harmless gadgets, can affect areas with implants. That's just a universally relevant lesson for well-being.
This deep dive into one very specific, unusual case really reminds us that even tools designed for simple tasks, if we use them without paying close attention to the instructions or our own personal context,
Yeah.
they can really shine a light on the incredibly complex and sometimes really surprising ways our bodies respond to the world around us, to external forces.
It really does make you pause and think, doesn't it? What other everyday devices or maybe even activities might we be engaging in without fully considering their potential impact, their interaction with our unique physiology, our past medical history, or, any devices we might have internally?
That is definitely a thought to carry with you. Thanks for joining us on the deep dive.
Keep exploring and keep asking questions.